National Advisor on Gender Affairs, Dr. Harriet Chigai, has called upon communities to take charge in the fight against gender-based violence. Chigai spoke while launching this year's 16 Days of Activism against Gender-Based Violence in Nairobi County. During the launch, it was reported that this year alone, cases of GBV have been reported to stand at 5,140 countrywide, and more cases are still being reported in various safety facilities across the county.
Kenya joined the global community in marking the 31st anniversary of the 16 Days of Activism against gender-based violence as the numbers of GBV cases in Kenya continue to rise, which in turn contributes to HIV prevalence in the country.
In as much as we talk about women being violated, we're also seeing a very high number of the boy child being a victim of violence. Sodomy in this country is never spoken about, but in Nairobi alone, out of 1,568 cases reported, it is shocking to note that 121 reported cases are actually young boys who have been sodomized.
According to a report by the Kenya Healthcare Information System of data collected between January and September this year, the numbers of rape survivors between the age of 0 to 11 years stand at 672, with 1,655 representing those between the age of 12 to 17 years. Victims with disability cases between the age of 0 to 17 years reported stand at 37.
There is work going on, especially being driven by the county government. And ours at the national level is to support what is already going on. And my office, and of course the office of the president, is keen to ensure that the promises made to the Kenyan people are actually adhered to.
Within Nairobi County, out of the approximately 1,000 hospitals that we have now come up with 48 SGBV integrated clinics that we call them Tumaini. We call them Tumaini so that we restore dignity and hope to survivors of sexual violence.
The laws are there, the policies are there, then implementation becomes a challenge. You'll recognize that within the wheel of justice, there are various facets or entities or agencies that need to do a certain activity to ensure that the whole cycle of justice is concluded. For instance, when you receive a victim of gender-based violence at the hospital, the first contact person then is the doctor or the nurse who receives them at the hospital. So the question then is, what are the gaps within the medical facility?
Even though in June 2021, the government of Kenya made a valiant decision to end GBV by the year 2026 through implementing GBV laws and policies, a number of gaps remain exposed, such as quality and timely medical treatment, limited access to shelter or safe houses, protection and financial assistance, among others. Presidential Advisor on Gender Affairs Dr. Harriet Chigai has assured of the government's commitment to the fight against GBV.
And now let's keep up with the drought watch.